Hello,
Hello, am I speaking with Mia Jones?
this is she.
Hey, this is Kayla. We talked a few days ago about that community assessment project. Do you have a few minutes for me to ask you a few questions?
I do.
Cool. I appreciate that. Okay, so before we get started, just want to let you know that this call is being recorded for my project. Do I have your permission to keep recording?
Oh, yeah, that's fine.
Cool. All right. So this project is basically a community health needs assessment. So I'm working with a few other nurses to determine two prominent health issues in Wake County. And our research has identified that mental illness and substance abuse is two of the top concerns for that area. So from our previous conversation, I learned that you probably are a good fit for this interview because of what you do. I think you mentioned that you're an NP student interning at like a therapy office.
I am. I'm a nurse practitioner student, and I'll be graduating this coming January. And so one of our internships is that we have to work at a therapy office. So, yes.
That's cool. That's cool. And even before that, what type of nursing did you do?
Most recently, I worked at a psych hospital. Before that, I did some ICU nursing as well as medical surgical nursing.
That's awesome. That's awesome. What hospitals did you work at, if you don't mind me asking, before you became an NP student?
Yes. Yeah, sure. I started out at Rex Hospital. I did a little bit of float pool med surge work at Wake Med Hospital, and then my psych experience was done at Triangle Springs Hospital.
So I guess in your internship, we'll start there. What types, and I don't want you to give away any confidential information, but what types of issues do you normally see a lot of?
The preceptor that I'm working under is a marriage and family therapist. So typically he deals with married couples that need marriage counseling, as well as complex family conflict related to like custody orders, and, separation, life after divorce, and that sort of thing.
I gotcha. I gotcha. So what you mostly deal with is marriage-related issues. Would you say that there's a mental health component with that?
Absolutely. I've found that working with couples kind of just gives you maybe two patients to deal with. In a sense, both couples have their own mental health that they have to manage, and then they bring that together, as a couple. And so as the therapist, you're dealing with how they interact together and how how their mental health affects their relationship.
I gotcha. I gotcha. Would you say that there's any depression or any suicidal things that you see in the internship?
I haven't seen any clients that were suicidal to date, but I have seen clients who were depressed. We've seen some clients that struggle with obsessive compulsive disorders, as well as bipolar disorders, and so on.
I understand. Okay. Okay. So that's definitely a big thing that we were seeing when we were doing our research. We're doing, like I said, a community health assessment, and mental health is a big thing that we're seeing could be undertreated in our area. Now, you also mentioned that you worked in psych as well. Can you speak to that?
I can. I definitely agree with you when you say that mental health in our area is undertreated. One of the roles that I had at the Triangle Springs Psychiatric Hospital was taking intake calls for people who were seeking mental health treatment. And so many times on the weekends, we would be too full to take them. And so we'd have to find, or refer them to another hospital that would be appropriate. And there were times we had to refer them to Virginia because there were no hospitals or facilities in North Carolina that could meet their needs.
That's crazy. And you know, I used to live in that area. I know Dorothea Dix was there and it closed down. So really, there's not too many other places like that, I'm assuming.
Not really. When you think of acute care, it's very limited in this area.
I gotcha. I gotcha. So that I would say is the mental health component. Have you noticed anything related to substance abuse?
I have. I've seen that there are some resources in the area for people that are struggling um, and need detox, but there's definitely a gap when these patients leave the hospital and they have to resume normal life. We see that patients typically end up coming right back because there's not really that many resources to take them from detoxing from the substance to, maintaining sobriety.
I gotcha. So what you're saying is for the places that are taking these people, it seems like they're more so overwhelmed by just returning patients. Like there's no ongoing outpatient follow up.
Yeah, I mean, we would typically, for discharge, have trouble and end up keeping people longer than they should, just looking for Oxford houses or places and programs that would accept people, following their detox period.
I gotcha. I gotcha. And I would say that probably is a long term issue. So would you say the gaps that we have for undertreatment, maybe intervention is to find maybe more therapists, MPs, PAs that can keep with that follow up? Would you say that that would be a decent intervention for this community?
Absolutely. I mean, staffing has been a huge issue, not just in psych and mental health, but in healthcare in general. So I would definitely say starting with trying to recruit more healthcare workers in mental health would definitely be a good start.
That's awesome. Well, we're still doing the project. We're getting all of our information and putting it together to see what interventions can help this community. I think that's most of my questions. I think you answered everything I needed. I really appreciate you for being a key informant or allowing me to do this interview. Is there anything else that you wanted to ask me about?
Um, No, I think you covered it. I would just say, along with recruiting healthcare workers, the facilities, people need to not only work in the places that are already established, but they need to be comfortable enough to branch out and open their own facilities. That way we have more overall beds in the area for these patients.
I gotcha. That's cool. That's cool. And I think that would probably be a long term fix. That makes
Mhm.
sense. Well, you know what? Thank you so much. I really appreciate your time, Mia. And I may have to follow up to get some more information, but thank you so much.
You're welcome. Sounds good.
All right, then. Bye.
Bye.